Good day. God bless you all. I am H. Robert Silverstein, MD, FACC, for the Preventive Medicine Center. If you have any questions about this show, please call me at 549-3444. First of all, we'll look at the date. It is, I guess, the 11th, 11/11/08. And today is Veterans Day, so it just happens to be the reason that I'm wearing the tie that I am and also the cufflinks that I am. The cufflinks are those of the American flag. Now, I doubt you can see that, but maybe you can see that if I go like this. They're in the shape of the American flag. They're made out of abalone, a mother of pearl, and they're really quite handsome. So this, by the way, is one of the shirts that I had made into a French cuff shirt. Now, as you can see, it doesn't have the fold-over French cuff, but I had the button taken off at Moe's Tailors downtown near the State House. And if you need that telephone number, give me a call at 549-3444. And I think it's a really cool style to change some of your regular shirts into cufflink shirts. Now, a number of things. I want to show you my shoe from today. This is a Nike Air Cole Haan. And maybe you can see inside where it says Cole Haan in there. There is a new Cole Haan store in West Farms Mall, and I'm sure everybody knows that Louis Vuitton is coming to West Farms Mall. And of course, these are a little bit difficult economic times, and these stores are a tad on the expensive side, but this shoe was not all that expensive. I wouldn't say it was cheap, but it cost what a moderately good pair of sneakers costs. And this is leather and unbelievably soft. This is one of the most comfortable shoes I've ever worn. I saw a pair of Louis Vuitton shoes like these that sold for $500. They weren't exactly like it, and they had Louis Vuitton written on there, but you couldn't see anything. And I just want to tell you what a comfortable shoe that is. Next of all, I said it was November 11th, and although we haven't had a great deal of cold weather, nonetheless, the store, REI, out in the Blueback Square of West Hartford is where I bought my long underwear. And I'm wearing my long underwear today. They're Patagonia long underwear, and it makes a huge difference for those of you who suffer from being cold during the cold weather as I do. Next, I want to talk about an article that appeared in the New York Times. And here is the New York Times from November 10th, Monday, November 10th. And it shows these soldiers which are in Afghanistan. It talks about AIG getting more money. But on the bottom of the front page is an article about cholesterol-fighting drugs show wider benefit. Now, this is a position that I have been taking. They're finally realizing, they're not listening to me, but they're getting the message and figuring it out on their own. When you subtract the good cholesterol from the total, that is all of the bad cholesterol. And you're not really just interested in one bad cholesterol, you're interested in all of the bad cholesterols. But you can sort of make some calculations and figure out what both are. For instance, subtract the good from the total, that's the non-HDL cholesterol. If you subtract 30 from that, that is generally the LDL cholesterol. In this article, they found a huge decrease in heart attack, stroke, sudden death, I believe, in people, 50% less likely to suffer a stroke or need angioplasty or bypass surgery, and they were 20% less likely to die. They brought the LDL cholesterol down to 55. And that, if you add the 30 to the 55, that comes out to be 85. 85 is close enough to the level that I've been recommending for a non-HDL cholesterol of 90. So basically, I have been recommending the LDL that they have, and they are recommending the non-HDL, which I have been recommending. And they found a 50% decrease, but they didn't find a 100% decrease, and that's because these studies tend to look at one factor rather than all of the factors. Now let's talk about some of those other factors. For instance, the diabetes test called the A1C. If you want to protect yourself, that number needs to be less than 5.5. Actually, in the high 4s is even better. And it is a direct relationship, like with the cholesterol, it's a direct relationship. The higher that LDL or non-HDL cholesterol is, the greater your likelihood of having a heart attack. The cardiac CRP, that was one of the tests that was studied in this particular study called Jupiter, in which the medication Crestor was used and found to be very effective. By the way, they specifically mentioned Dr. Wolf, who is in Washington, D.C., and at the offshoot of Ralph Nader organization. And Wolf came out against Crestor in an absolutely ridiculous fashion from my point of view. Very unsound-worthy thinking and very radical thinking, very improper thinking. And he has not commented much on this. They did interview him for that article, for this article in the New York Times on November 10th. By the way, for those of you who may not know, the New York Times on the day of the election, or the day after the election of now President-elect Obama, was selling for $200. If you had one of the New York Times on that day, it was worth $200 on eBay. That was considered a great moment. Well, anyhow, back to this. So we're talking about a non-HDL cholesterol less than 90, or an LDL cholesterol of right around 55 to 60. We're talking about a cardiac CRP of 1, an A1C of less than 5.5, a magnesium above 2.1, a blood count hemoglobin of around 14, an LPA, that's LP little a, lipoprotein little a, of around 8, homocysteine around 8, and triglycerides of less than 100. And that is more or less how you virtually prevent all heart attack if you use medications. But you can also do this naturally, which is not discussed in here. But on the other hand, the American public does not seem interested in doing it naturally. When you give up the chicken and the meat and the cheese and the eggs and you move over to the brown rice, vegetables, beans, fruit, nuts, and seeds and reduce your percent body fat to the point where you can see the muscles meet the muscles meet the muscles on the abdomen. It's called lines of definition. Doesn't have to be great big six-packs, just lines of definition, because there is an absence of fat under the skin. Today I saw a woman who cooks brown rice, vegetables, beans, quinoa, amaranth, miso soup, sea vegetables. She was 5 feet 4 inches and 140 pounds. And she had a little paunch in her middle. And I told her that she was doing great, better than most of my patients, but it wasn't competition. She needed to reduce that fat that was around her middle. So at 5 feet 4 inches, 140 pounds on her was approximately 10 to 15 pounds, maybe even a little more, overweight. Generally, I say 110, 115 for 5 feet 4 inches, but remember, I'm talking about health. If your individual preference is higher, then you may choose to do that, but the arbiter, what tells you that you're at your proper percent body fat, is whether or not you can see where those muscles meet the muscles on the abdomen. By the way, she was a woman, and so I am talking about 5 feet 4 inch women, not 5 feet 4 inch men. So